Hello, my name is Chama Onyechaka. I am a PGY1, about to be a PGY2.
My name is Ariana Hernandez. I am from Puerto Rico. I am a IMG medical student.
I am Dr. Thomas Pack. I am in my second year of residency at the University of Texas Southwestern.
I am a resident fourth year at Adolescent University in Dominica.
I am a fourth year medical student at the University of Texas Medical Branch.
Currently, I am a recent graduate of Albert Einstein College of Medicine.
Second year now, psychiatry resident at the University of Minnesota.
I'm going through my residence training in a University of Missouri at Toronto.
I'm an incoming psychiatry resident in New York City.
I recently got married, so I'm also now a wife and a daughter. And
I'm a father and I'm a husband.
I'm raised by Nigerian parents, so I do have that Nigerian blood in me. So I definitely am a proud Nigerian.
I feel both connected to my Korean roots, but also being born here, I feel very connected to the States.
I identify as a future child psychiatrist.
Interested in pursuing child and adolescent psychiatry.
Child and adolescent psychiatry.
An advocate to all of persons that doesn't have healthcare access.
I would love to work with adolescents, specifically in the field of psychiatry.
Also a future child and adolescent psychiatry. It all started when I was in my first clinical rotation. I realized so many patients not just are physically ill, and their mental health were actually affecting their physical health.
One story that stuck with me is about a woman who came in. Her pain was so severe that she actually wanted to die by suicide. And she was submitting all these applications to get euthanasia done. But she had idiopathic facial pain. It wasn't a terminal disease that she had. And through these months, I saw how great the psychiatrists were, how treating her depression made the pain so much better. And after a few months, seeing her and her daughter eat ice cream together, having this big family moment together, really inspired me to do psychiatry.
I had the opportunity to shadow psychologists, psychiatrists, social worker, and it really got me interested into child psychiatry, specifically because I get to work with the family and the whole system.
I had a lot of time passion to hear stories and to read stories. Then when I went to med school, I also developed an interest in neuroscience.
I realized how unique psychiatry is as a specialty, where we're using our voice to heal aside from the medication management that we do, especially in treating an illness that might be invisible to society.
I love children and adolescents to talk with them. I enjoy a lot their innocence, and it's just not that. It's just, I feel really connected with them.
You can act goofy around kids. They love that, being able to connect with them at their level. It's just such an amazing connection.
But I just really enjoyed interacting with them and getting to know them, getting to know their stories. And that is what drew me towards psychiatry, as I knew that I could continue to kind of build those long-term relationships with patients.
I have to admit, my mom, funny enough, was a child psychiatrist, and I actually was a kid when she was going to school. So I kind of saw that process. I think that it's a field that is underserved, I would say, and just not well recognized for its importance and how it impacts disease process and life in general.
A lot of the issues that presents with these adult patients really stem from what's happened in their childhood. And if you can start earlier, if you can make a difference in their childhood, you can change their entire trajectory. And to me, being able to move a person's life in such a way makes such a huge difference. To me, I find a lot of meaning in that.
I was at this really cool panel held by a Latina psychiatrist, and she was talking about how we should utilize our culture when working with patients. I do personally feel very close to my culture, and I feel it's kind of resonated in my interactions with patients in a positive way.
The BIPOC has helped me connect with my patients. When I think about some of the teenage girls in the pediatric inpatient unit, I was able to connect with them. Sometimes they don't want to talk to anybody.
It's invaluable to be able to talk and work with someone who looks and you feel like you can kind of identify with in some ways?
Sometimes we are talking with a patient and there are so many things about the culture that influence their way of thinking. And sometimes if you're not from their culture, you will think, okay, that's not okay. But in their culture, that's a normal thing.
And I realized that our bedside manner and the way we carry out our conversations is very important. So I would kind of like ask questions in a more curious but yet informed manner, so as to kind of respect the boundaries between me as a physician and them as a patient.
I feel that I can connect with other patients who do have like this feeling of that they don't belong, people who might come from different communities. Having the patience to work with them and understand where they're coming from, to me, I think that makes it easier to empathize and to put in extra time for these patients.
I always say that I want to be a physician that's involved in the community so they can see me in both settings. So whenever we have some of the teenage patients, some of the physicians already know that, call Bianca, she'll be able to talk to them. And I take that as an honor because that's the population I want to work with.
I've had a lot of people that have supported me with advice, answering questions, sharing opportunities, writing recommendation letters, and I hold every one of them to heart because they have really, really come through for me, and also just remind me that I'm good enough.
Medical education is hard. Honestly, going through med school, now going through residency, there's really long nights. There's times where you feel like you don't know, that you have this imposter syndrome. It's like, these patients' lives are in my hands. Can I really make it as a doctor?
By having that guidance, and for me as a Latino, that have been like a really important thing.
My mentor in medical school, she taught me to not be afraid of who I am, to speak up, to hold my head high, and just use my voice, no matter how it may look or no matter how it may feel.
Some IMGs, peers, colleagues that gave me advice that were specific to IMG on how to get in residency and specifically child psychiatry pathway.
Having colleagues that I could talk to and be honest and vulnerable with. I definitely came in thinking like, I'm gonna just stay to myself and I'm just gonna get through this. And I really thought it was almost like a sprint. And I realized, no, this is a very long journey.
And mentorship can come in different forms, because now that I look back, and it doesn't have to be the highest position, I would say those ultrasound technicians were my mentors. The staff, when I was a high school student, they were my mentors. At that point, it wasn't the physicians that I worked with. It really was a staff.
There would be moments that you don't believe in yourself or doubt yourself because it's an easy process. So having those support really make a difference.
My mentors were all at different stages of their career, ranging from residents to attendings. So they have offered me countless perspectives about each stage in their life. And in a way, it has kept me accountable and focused on my own career trajectory. They gave me opportunities to spearhead research projects and to present at ACAP conference as a medical student.
I was so lucky to get the support and mentorship of amazing doctors in the field of child and adolescent psychiatry. I got the support from people in the ACAP.
It's very much a family, and that's something that I very much value within ACAP. I feel like it's a family, and in particular the Asian caucus. I feel that they've been super supportive.
It's been my home because during 2020 with George Floyd and everything, I looked forward to my ACAP meetings with the Black Caucus. I genuinely enjoyed going to the meetings because we were able to be ourselves.
I was able to find other Hispanic and Latinx identifying physicians, psychiatrists specifically, that were doing exactly what I wanted to do.
It's just been a great opportunity, so I'm really happy to be a part of this.
And just know, if you want to be a child and adolescent psychiatrist, this world really needs you.
I think that there are so many children out there that just need help. There's a lot of work that can be done very early on. And so anyone who really wants to be able to make that kind of impact in someone's life, I think this is the field to be able to do that.
While there are many sacrifices when it comes to becoming a physician and becoming a psychiatrist, it's so worth it. The work is so rewarding, and I'm really excited to see, the next generation of psychiatrists and physicians. There are people out there that are rooting for their success regardless of their background, and acknowledge, that they have surely faced their own share of obstacles to get to this point.
If someone denied you and a program denied you, it's okay. Just keep trying and don't stop, and know that you are a really vital person for those patients' lives.
You're joining such an amazing community, child and adolescent psychiatrists. Like, it's a commitment to do this fellowship, to want to work, to do these extra 2 years of training. And the people it attracts, the people who are willing to put in that time, are people who really care, who really want to go the distance for kids.
If you feel like you need some support, don't be afraid to reach out for help. There would be moments that you don't believe in yourself or doubt yourself, because it's not an easy process. So having those support really make a difference.